One.
Well, welcome to an Ask an MS Expert. My name is Emily Riley, and I am the moderator for this wonderful program. I am a proud Air Force wife, dog mom, certified personal trainer who teaches adaptive fitness classes for the MS community, and I've been living with MS for over 18 years. I am currently located at Scott Air Force Base. Well, thank you for joining us. The National MS Society is committed to offering a place to connect and ask questions to MS experts on topics impacting veterans affected by MS. MS navigators are online throughout the program, answering questions and providing resources. So please post any questions or comments that you may have in the comments box on Facebook, YouTube, or Twitch. I would like to acknowledge and thank today's national sponsor, Lockheed Martin. Support from MS community partners helps the National MS Society reach our goal of providing up-to-date information and support through programs like Ask an MS Expert Veterans Program. Now, today, sleep plays an important role in your physical health and well-being. At least half of people with MS have problems with sleep, and it is common among military veterans. Joining me today to talk about managing sleep problems with MS is Dr. Tiffany Braley. Dr. Braley is the Holton Garrett Family Professor of Neurology at University of Michigan Health. She is an associate professor of neurology and section head of the Multiple Sclerosis and Neuroimmunology Division. A primary focus of Dr. Braley's research is the impact of sleep on the course and symptoms of people with MS. Dr. Braley receives material support from Jazz Pharma and financial support from the NIH, International Progressive Alliance, MS Alliance, and the National MS Society for research projects. I'd like to ask Dr. Braley to join me on camera. Thanks so much for being here today.
Thank you for having me. It's great to be here.
Yeah. All right. So sometimes it is difficult to get quality sleep. Lack of restful sleep can cause daytime drowsiness and make some MS symptoms feel worse. So, what are some factors that play a role in getting high quality sleep, and why is it important for people living with MS?
So there are many factors that can play a role in our sleep quality, and this includes family and social demands, schedules of both the person who's living with MS, but also schedules of other people in the home, schedules of their bed partner, the sleeping environment, including noise and light exposure, substances such as caffeine and alcohol use, and then some biological factors as well. So, for example, physical and mental health problems, medication use, and even hormonal factors and age. And these are particularly important when considering people with multiple sclerosis, because we do know, as you mentioned, that poor sleep can make certain MS symptoms worse. We also think that sleep in the long run has the ability to impact long-term function and possibly even the clinical course of MS.
Yeah, it's a little complicated and kind of layered. So I'm excited to kind of dive into some of these things. Veterans and people with MS are more likely to develop sleep disorders than the general population. What causes sleep disturbances in these two groups?
Yeah, so indeed, these are both vulnerable populations. In terms of the veteran population, we know that both that the stress and also schedule changes associated with training and deployment or combat, and even the stress of returning to civilian life, all have the potential to directly affect sleep or even indirectly affect sleep by their influence on other mental health problems that are associated with sleep issues. From an MS perspective, we know that chronic symptoms in MS can actually make sleep worse. Certain symptoms, including bladder dysfunction, which can keep people up at night, spasticity, chronic pain, again, mental health problems, which are also common in the MS population. And then some of the things that we ultimately give our patients. So medications, for example, for fatigue, if taken at the wrong time of day, can make MS, make sleep worse for people with MS. And then we also think that possibly even the MS itself, our group and other groups as well have identified associations between the location of certain MS lesions, for example, lesions in the brainstem or the spinal cord, that might actually increase the risk of sleep disorders, certain sleep disorders in people with MS.
Interesting. Wow. Okay, so let's talk a little bit more about common sleep disorders that veterans and people living with MS are likely to experience. So insomnia is reported to occur in 90 to 100% of Vietnam-era veterans with post-traumatic stress disorder, also known as PTSD. And it was also most commonly reported that PTSD symptoms in a survey of veterans from Afghanistan and Iraq. So What is insomnia and why are sleeping challenges prevalent in veterans with PTSD?
Yeah, so insomnia can either be a symptom or a disorder. I think it's important to make that distinction. As a symptom, insomnia is simply characterized by difficulty falling asleep, staying asleep, or waking up earlier than would be desired normally. But it becomes a disorder when the symptoms become frequent, so usually more than 3 times a week, chronic, present for at least 3 months, and the symptoms are interfering with your daytime function. And in this regard, yes, PTSD is thought to be, it has a close relationship with insomnia. We do think that PTSD is a driver of insomnia due to the hyperarousal state that's associated with PTSD, which makes, that's associated with the condition, which makes it difficult to engage in the normal processes that are associated with good sleep. We also know, since PTSD is also associated frequently with nightmares, that this can also contribute to insomnia and the ability to fall and stay asleep. And it gets a little bit more complicated still when you consider that sometimes alcohol is used to self-manage these symptoms, which can definitely have an impact on sleep as well. And so there's a lot that we're learning about the relationship between all these factors. I think it's very interesting that recent research also suggests that poor sleep, sleep deprivation, or insomnia, especially if it precedes the traumatic event that causes the PTSD, may actually be a risk factor for it. And then insomnia can actually perpetuate the PTSD. So it's almost a bi-directional relationship.
Yeah. Oh, so interesting. Now, Wendy's husband, Chip, snores loudly at night. And Wendy, I get you, mine does too. They sleep in separate rooms. Wendy thinks he has sleep apnea, which is another common disorder for veterans and people living with MS. So can you explain what sleep apnea is and how can Chip figure out what he's experiencing?
Sure. So yeah, it sounds like Chip definitely, a good chance that Chip has obstructive sleep apnea. So obstructive sleep apnea is the most common form of sleep apnea. And it's characterized by either a partial or a total collapse of the upper airway during sleep. And ultimately, this leads to decreased airflow and therefore decreased oxygen levels during the night and a lot of sleep fragmentation as someone has to keep waking up and taking a breath. And sometimes this is associated with witnessed apneas, sometimes not, but we do know that snoring is very common and thought to be kind of a red flag for obstructive sleep apnea. And its presence, if Chip has good contact with his doctor, it's important that he mention this to his physician or his other healthcare providers to determine what type of sleep testing to order. Typically, an overnight sleep study is done to diagnose obstructive sleep apnea, either in the laboratory or there are home-based ways of doing this as well. But this is typically the diagnostic test that we would do to not only diagnose sleep apnea, but also determine its type and severity.
Okay. So Anita experiences restless leg syndrome when she goes to bed and it's difficult for her to fall asleep. Can you describe what restless leg syndrome is for us?
Sure. So restless leg syndrome, even though it's considered a sleep disorder, it's actually something that happens when people are still awake, and it interferes with sleep, which is why it's considered to be a sleep disorder. But it's characterized by a discomfort in the legs, most usually the legs, although sometimes also the arms in severe cases. That typically occurs when someone is at rest, either sitting quietly for long periods of time, or when they're laying down to try to go to sleep. And it's associated with an urge to move. The discomfort sort of causes people to want to move the legs. And it's usually associated, or should be by definition, associated with some sort of relief when the legs are moving, even if it's only partial relief. And the diagnosis is fairly common, even in the general population, but it's even more common in multiple sclerosis. And again, this might be because the MS itself plays some sort of a role in risk. But additionally, there are other common risk factors, including certain medications that are used. People with low iron levels also have a chance of having a higher risk of restless leg syndrome. And if the symptoms are bothersome enough to interfere with sleep, then certain medications might be considered to treat it symptomatically, or certainly iron supplementation could be considered if the iron levels are low and thought to be contributing. There are also some new devices being explored for the treatment of restless leg syndrome. And exercise is even being explored as a possible way of treating it.
Hey. And lastly, fatigue is one of the most common symptoms of MS, occurring in about 80% of people. So Hillary experiences a lot of fatigue, and she also has poor sleep. So she's wondering if her fatigue is from MS or poor sleep, or is it all connected? I think this is often a question. A lot of people living with MS are always like, is it the chicken or the egg? Which one is it?
Yeah, no, you could spend a whole hour, I think, just on this, right? It is complicated. And in her case, it's, it's possible it's both. We do know that fatigue is highly complex symptom. And in general, we think it's something that's what we call multifactorial. So it likely has more than one driver, but those drivers can vary quite a bit from person to person.
Yeah.
And if you break it down, most of the time we consider fatigue to have primary causes. So for example, the MS itself, and also secondary causes, including sleep disorders, which we know are in fact one of the most common secondary causes of MS fatigue. Both in the MS population and the general population, sleep disorders are associated not only with sleepiness, but also fatigue. And in this case, we usually do recommend if a sleep disorder is suspected, to do our best to identify and treat it, because in many cases, the fatigue may at least partially improve. It may not completely improve, but sometimes we don't know until we go after the addressable causes and see what residual fatigue is still present. Do we know how much might be MS versus from another cause?
Yeah. Okay. So if someone is experiencing sleep disturbances like the ones we've just mentioned, what is the first step for them to take?
Yeah, so I would just say, be prepared to talk to your primary doctor or neurologist about this, even if it isn't something that is raised as a topic during the visit. Sometimes, you have to be the one to kind of be vocal and say, I want to talk about my sleep. And it's good to be prepared to share information about your bedtime schedules, the chronic daily symptoms that you're having that you think might be driven by the sleep problems. And if a bed partner is available, it's also helpful to have them present to give their input. So the more information that's provided, the easier it will be for your doctor to recommend the appropriate testing and treatment.
Yeah, having that open communication is important, and making sure that it's something that you write down in your notes before you go see your doctor so you don't forget.
Yes.
Yeah.
It's in busy practice, sometimes we're so focused on, okay, what does the MRI show? How is your disease modifying therapy going? There is a lot to cover, and sleep, unfortunately, does not always get its due in a busy clinical practice.
Yeah, but clearly it's an important one to make sure we keep track of. So when it comes to treating sleep challenges in MS, it can be difficult because there may be so many causes, kind of like what you mentioned. So what kind of medications are usually provided or prescribed for sleep disorders?
Yeah, so the medication types and our thresholds for using them depend very much on the type of sleep problem, what's causing the sleep problem, and then the person experiencing the sleep problem. We try to tailor, each treatment towards the individual. For insomnia specifically, generally we think about behavioral approaches as first-line treatment before medications. But if medications are needed, there are a number of prescription, what we call hypnotic medications that can be used. They vary in terms of how they target sleep, and they also vary by side effects. So it's really important to consider each side effect carefully if you're thinking of starting prescription hypnotic under the guidance of your doctor. In terms of restless leg syndrome, like we mentioned earlier, there are certain medications that can be used if the RLS is severe or interfering with sleep. A class that we use frequently I think in MS in general, and certainly in my clinic, are a class of meds called the alpha-2 delta ligands. This includes gabapentin, which often has benefits not only for restless leg syndrome, but other symptoms that people with MS experience, which makes it nice. There are others as well. Certainly we would recommend supplementing with iron if someone was iron deficient. There are different classes depending on each sleep disorder. There are other medication options available for rare sleep conditions that we don't see as often. And then if you consider, the daytime consequences, there are wake promoting agents and stimulants that can be used for residual fatigue or sleepiness that maybe somebody's got a sleep disorder and they're sufficiently treating it, but they still have residual fatigue or sleepiness. Then in that case, sometimes these other stimulants or wake promoting agents can be used. It's just, again, one side effect that you always want to consider, no matter what drug you're speaking of in this class, is making sure that you're not taking them too close to bedtime, because that might actually be sort of, the opposite effect of what you're looking for when you're trying to improve sleep.
Sure. Yeah, I know often I've thought about like, can I take melatonin? And that's not necessarily like a prescribed kind of a medication. Is that something that's helpful?
That can be helpful in the right circumstance. And I'm glad you actually brought up over-the-counter medication. So melatonin, generally, a lot of people use it to help them fall asleep, but melatonin is actually more effective when it's used to try to align someone's circadian rhythm, or if they want to shift their bedtime. So generally, it's not thought of to be a true, a hypnotic in the true sense, but it can be used if someone is having difficulty with sleep problems. I generally advise against using over-the-counter sleep aids. Most of these contain just old-fashioned antihistamines like Benadryl, and we know that Benadryl, we've actually done work on this, that it can actually increase the risk of fatigue and carryover fatigue the next day. And this isn't just true of people with MS. This has been shown in other populations as well. And it also has the possibility of impairing cognitive function. So the Benadryl hangover is something that I typically advise my patients to try and avoid.
Okay. Sounds like we should just keep let our doctors know if we're wanting to try something before.
Exactly. So, again, each one of these medications, has nuances to it, and it's important to make sure that you discuss the goals of treatment and also the side effects with your physician.
Sure. Okay, so we talked a little bit about sleep apnea. So Eric has sleep apnea, and his doctor wants him to try a device called a continuous positive airway pressure machine, also known as a CPAP. Can you tell us about the CPAP machine, and are there any other medical equipment options to treat sleep disorders?
Sure. Yeah. So positive airway pressure therapy, or PAP, is it is kind of considered the gold standard. So it's a non-invasive way of treating sleep apnea, where you have a machine that's attached to a tube and a mask. And there are many, many different mask styles and models depending on your preference. And the device actually blows air into the upper airway to splint it open and keep it from collapsing during sleep, because that's the issue with obstructive sleep apnea. The airway is collapsing at night. And the pressure that's used depends on the sleep apnea severity, the type of sleep apnea. If it's one constant pressure all night, we consider it to be continuous positive airway pressure, or CPAP. But you can also have bi-level, where the pressure varies based on the respiratory cycle, and that's called BiPAP. And again, it's generally considered the gold standard for sleep apnea. There are other options, including oral appliances potentially for people to try to reposition the jaw to see if that can also help with the airway collapse. These potentially are better more for milder forms of sleep apnea rather than more severe forms. It's generally not advised for more severe forms of sleep apnea. Positional therapy is something that can be considered if someone is, really having intolerances to all of the treatments we would normally recommend, typically laying on the side, using devices that encourage you to lay on your side rather than on your back. There is, a surgically implantable device that can be implanted if the patient fits the right criteria, that actually stimulates those muscles, those upper airway muscles, to contract during the night to keep the airway open. But generally, positive airway pressure would be the first place to go. That would be considered first line, and usually these would be alternatives if for some reason PAP therapy couldn't be tolerated.
Okay. I'm sure that takes some time to also get used to wearing something like that at night.
Yeah, absolutely. And with practice, it's certainly something that people do get used to. And most people, with close guidance, I think that's really the important piece of this, is having close communication and troubleshooting. And if something doesn't work, adjust, right? So that people can successfully start using it. And it's, been shown to improve not only the sleep quality, but also daytime symptoms.
Great. Okay, so now we can kind of talk a little bit more about, like you had mentioned, a little behavioral changes. And so cognitive behavioral therapy is an effective treatment for insomnia. It also helps other mental health and behavioral conditions. So can you tell us a little bit about the cognitive behavioral therapy and what someone can expect?
Sure. So cognitive behavioral therapy, or CBT, comes in several forms, and for management of several symptoms. And it's been something that we really do lean towards, especially in our MS population. But CBTI specifically, so CBTI, or cognitive behavioral therapy for insomnia, is the primary recommended non-pharmacological or non-medication option for chronic insomnia. And it addresses multiple behaviors, actually. It focuses on negative thoughts and behaviors and beliefs that are associated with poor sleep outcomes. And it's given over several sessions, and this can be done either in person or through telehealth. And sessions focus on a number of factors that are thought to influence sleep, including stimulus control, the amount of time in bed, sleep hygiene education, and relaxation techniques. And all of these things can ultimately empower the individual to sort of shut down those negative thoughts that are making sleep worse and develop some better sleep behaviors. And it's been shown to not only be at least as good, if in some cases not better than medication, but have lasting effects.
Wow, that's great. So living with a chronic illness often comes with like a lot of different medications, and Vanessa doesn't want to take more medications. So she wants to know if you have tips that she can do on her own to improve her sleep.
Sure. So of course, treatment always depends on the sleep problem. And as we talked about, these problems can be, pretty broad. But for common sleep disturbances, a good online resources to go is the National Sleep Foundation. And they have great information about the type of symptoms that you have and what that might mean, and also some great tips just for targeting common sleep disturbances that people experience. Again, it's not a replacement for a formal sleep evaluation with your healthcare provider, but it can be a good start, and it could also facilitate the dialogue that you have with your provider.
Yeah, definitely. Okay, so Jason was diagnosed with sleep apnea, and he wants to know if the VA offers disability compensation for sleep disorders.
Yeah, so in my understanding, compensation may be possible if the individual is already service connected. And if the sleep disorder has been formally diagnosed and documented by the provider in the medical record. I have, and this is something that I would encourage others to go read more about, but I've also heard and seen that if in cases where you can associate the sleep disorder diagnosis with the MS diagnosis, that this may also be helpful. But the Paralyzed Veterans of America can certainly provide more information if we have some resources that we can show at the end on that.
Great. All right. So Nicole is wondering if there are VA resources that help with sleep challenges, and how does one access them?
Sure. So one of I think the nicer ones that is free and online is something called Path to Better Sleep. This is a VA-based training course that can actually provide veterans with sleep education and also help them navigate sleep challenges.
Oh, that's great. I'm all for like a free thing that you can kind of do at your own pace.
Exactly. Self-paced.
Yeah. Well, great. Well, you've shared a lot of really valuable information today. I think hopefully this will help people kind of start thinking about their own maybe potential sleep challenges. And so if someone was listening, what are the 3 top takeaways that our audience can maybe begin to act on like right away?
Sure. So the first thing I like to just mention is that sometimes, even if you're struggling with chronic symptoms during the day and you don't think you have sleep problems, sometimes the way that sleep problems manifest is actually through daytime impairment and chronic symptoms, especially when it comes to fatigue, cognitive impairment, sometimes even thresholds for pain. So if you're having conversations with your MS provider about fatigue or cognitive impairment, I would definitely encourage you to consider factoring in sleep as part of that conversation, and being very forthcoming about your sleep patterns with your provider to decide if maybe targeting sleep might be one potential treatment mechanism for these symptoms. The second is having a constant, a consistent sleep schedule, I guess. It's, of course, we always encourage people to get adults still need 7 to 9 hours of sleep per night. But even if you're getting 8 hours of sleep per night and that it's all over the map in terms of when you're going to bed and when you're getting up, this can really have an impact on both physical and mental health. So setting the wake schedule and the bedtime schedule and trying to stick with that, even on the weekends, generally is considered to be better to help you function at your best. And you can also discuss ways to help, pick the schedule or choose the schedule with your sleep providers or your neurologists. And then lastly, this is something that all of us, I think, need to work on more. And this isn't necessarily specific just to people with MS or veterans, but just the screen time, being mindful of the screen time, the bright blue spectrum light that's on our screens, on our phones, on our tablets, on our TVs. It really is a stimulus to the brain to stay awake. And so, and not only that, but the content that we're viewing sometimes, even if it's good content, if it's exciting, it's something that's going to stimulate our brains to stay awake rather than letting those natural sleep processes start to take place. And so generally, a lot of experts will recommend trying to stop the screen time at least 1 to 2 hours before bed. And in the hours leading up to sleep, having a routine that you can get into and start preparing your body and your mind for sleep.
I'm so glad you mentioned that because, I live with MS and I experienced some sleep challenges, and we removed the TV from our room, and I started reading at night rather than looking at my phone. It really has helped in like creating those habits because, I realized that was like keeping me up and making it hard to go to sleep. So I'm so glad that you mentioned that. Because
it's very difficult, and we almost call it social jet lag now, right? We have to be on so much, and so much of what we do involves our devices. But yeah, if you want to read, that's a very good point. Going back to the old-fashioned, paper books, which kind of has its own value. So something that can still be done at night.
Yeah, great. Well, thanks for sharing your expertise on this topic. Now let's focus on our time on addressing some additional questions that our viewers have for you. And so let's see. Maya is wondering, how do depression and anxiety impact sleep?
Another one of those somewhat bidirectional relationships where you have both things feeding into each other. So we know that depression and anxiety are associated with brain changes that can make it difficult for someone to either fall asleep or stay asleep. But on the flip side, sleep deprivation and insomnia can also increase your risk of these mental health problems. And so it's typically recommended that we try to address both issues simultaneously for the best effect.
Okay, great. And then Steve, he's wondering, how can sleep challenges impact cognitive function?
Yeah, that's a great question, especially given what we were touching on earlier about cognition. So there's a good amount of evidence that has been generated studying the effects of sleep problems on cognitive function, both in non-MS populations and also the MS population. And data from our research group and some other research groups is definitely shown as a strong association between sleep problems and cognitive problems in people with MS. And this can be a number of sleep problems. Obstructive sleep apnea, we think, plays a role, as does just sleep fragmentation in general. And a couple of the studies that we've done so far have shown that the sleep problems seem to really have a specific impact on delayed memory, but also visual spatial memory, something that we're learning more about, possibly verbal memory. And sleep disorders in general can also have an impact on attention. So definitely, this is, I think, a topic that deserves a lot more due. And I'm grateful for the question because, again, if you're having cognitive issues, it really is important to make sure your sleep is being examined as part of that evaluation.
Yeah. Well, great. Well, thanks again for everyone who submitted questions. And thank you, Dr. Braley, for being with us today and sharing all this really great information and encouraging us to have those open lines of communication with our providers so we can address these sleep challenges. Well, I would like to remind everyone that you can connect with an MS navigator via phone, email, and through the Society's website via chat. For information and resources on MS, visit the Society's website. You'll find research, updates, and news, self-help groups just for veterans and active duty military, and for more ways to get involved and upcoming events near you. Now, you can connect with the National MS Society and others affected by MS via Facebook, Instagram, Twitch, Twitter, YouTube, and LinkedIn. So I encourage you to like, subscribe, or get on the Society's mailing list to continue to receive up-to-date information on MS and updates on upcoming programs. Again, I want to thank Dr. Braley for sharing her knowledge and for everyone's engagement in today's program. The recording will be made available on the Society's website at www.nationalmssociety.org/MS expert. I invite you to join us in November for our next Ask an MS Expert Veterans Program. Lastly, it is important to get your feedback on today's program. You'll see a link, a survey linked to the comment section or in the program's description on Facebook, YouTube, and Twitch. Completing the survey makes a difference, and it only takes 1 minute to complete. The information you provide helps continuously improve and shape future segments. So thanks again for joining us today, and we'll see you soon.